Good morning, ma'am. I'm Dr. Daryl Hipolito. How would you like me to call you?
Good morning, Doc. I am Anna.
Okay, Anna. Now, before we start, I would like to ask some questions and your history to better understand your condition.
Good rapport creates a close and harmonious relationship with patients. It allows you to understand your patient's feelings and communicate well with them. Explain the purpose of the interview and get the patient's consent.
I assure you that all information gathered here will be within our medical team. Is that okay with you?
Yes, Doc.
Okay, let's start. What's your full name, Anna?
Juana de la Cruz.
Your age?
I'm 23.
Your marital
Note the
status,
day
ma'am?
and time you assess the patient. Note the gender of the patient. If not sure, ask the patient if he or she is a male or female. The patient is alert, comfortable, well-groomed, appropriately dressed, and cheerful. The patient maintains good eye contact, cooperative, and answers the questions willingly. Grooming and personal hygiene may deteriorate in depression, schizophrenia, and dementia. Excessive fastidiousness may be seen with obsessive-compulsive disorder. One-sided neglect may result from a lesion in the opposite parietal cortex, usually the non-dominant side. Speech is fluent and words are clear. The patient's stream of talk or speech is at normal rate with regular volume and tone. Note the slow speech of depression, the accelerated, louder speech of mania. This author refers to defective articulation. Aphasia is a disorder of language. Dysphonia results from impaired volume, quality, or pitch of the voice. The patient's mood is relaxed with an appropriate affect with his response and not emotionally labile. Check the mood range of patients from sadness and melancholy, contentment, joy, euphoria and elation, anger and rage, anxiety and worry, to detachment and indifference.
Do you see things that others might interpret differently?
I don't think so, Doc.
Now, do you see or hear things that I might not be able to see or hear?
No, there's nothing.
Now, do you have any persistent beliefs that might be quite different? For example, do you feel like there's people trying to harm you?
No, none.
Illusions may occur in grief reactions, delirium, acute and post-traumatic stress disorders, and schizophrenia. Hallucinations may occur in delirium, dementia, post-traumatic stress disorders, schizophrenia, and alcoholism. The patient is awake, alert, and aware of his surroundings. The Glasgow Coma Scale for tracking the level of depressed consciousness. The level of consciousness can be assessed objectively using the GCS. Patient who has a disorder of consciousness, disorientation, amnesia, misperceptions, hallucinations, often vivid delusions, brief attention span, disconnected thoughts, irrational or incoherent mutterings, and abnormally decreased or increased psychomotor activity or agitation. We could use the GCS to assess the patient.
Please subtract 7 from 100 until I tell you to stop.
193, 86, 79, 72.
Okay, stop.
The causes of poor performance in attention includes delirium, dementia, intellectual disability, and performance anxiety.
Now, can you tell me the date today?
20,
The month?
March,
The year?
2021,
The day of the week?
Saturday,
Can you estimate the time of the day?
10 a.m. in the morning.
Can you tell me the name of your watcher?
Lebron de la Cruz.
Can you tell me where we are right now?
We're at your clinic, Doc.
In what
The
floor?
patient's score here is 5 over
What
5,
country?
which means the patient
And
answers
what
the
city?
questions
Milan
correctly.
City.
This orientation is common when memory or attention is impaired, such as in the case of delirium.
Now, I will ask you to remember 3 words. Mango, table, and coin. Can you repeat them for me?
Mango, table, and coin.
Recent memory is impaired in dementia and delirium. Amnestic disorders impair memory or new learning ability and reduce social or occupational function, but lack the global features of delirium or dementia. Anxiety, depression, and intellectual disability may also impair recent memory.
Now, keep the 3 words in mind as I will ask you them what they are. When is your birthday?
January 12, 1998.
The last school you attended?
UNP.
Now, at the beginning, I asked you to remember 3 words. Can you tell me what they are?
Mango, table, coin.
On the other hand, remote memory may be impaired in the last stages of dementia.
Can you name me the last 4 presidents of the Philippines?
Benigno Aquino III, Gloria Macapagal Arroyo, Erap Estrada, and Fidel V. Ramos.
Now, can you tell me the name of the present president and the vice president of the Philippines?
Rodrigo Duterte and Leni Robredo.
Now, what do you think of your illness?
I think my illness is not so serious. It may be because of stress or because of heavy workload. And I don't think I need to stop working.
Patients with psychotic disorders often lack insight into their illness. Denial of impairment may accompany some neurologic disorders.
What will you do after this consultation?
I will have my lunch further and maybe get back to work.
Now, good, and avoid stress and relax. Now, I will ask you something. What should you do if you suddenly wake up and find a fire in the corridor of your room?
I will look for the fire extinguisher, and if I can't, I will seek help or I will scream.
Now, what are your plans for the future?
Continue working or maybe start my own business.
That's good.
Judgment may be poor in delirium, dementia, intellectual disability, and psychotic states.
So, just draw a clock and have the hands placed at 25 minutes past 12.
The patient was able to draw a clock and the hands were in the correct position, so that is a score of 10. CDD is used for constructional and visuospatial apraxia. This is good for testing executive function, mostly by the prefrontal lobe function. A score of 5 and below implies that the clock drawing test is not intact, which is possibly caused by cognitive and specific executive dysfunction. Overall, the patient is awake, alert, and aware of his surroundings. He is also capable of abstract thinking, exercises good judgment, and has full awareness of his or her illness. MMSE score of 30/30 and CDT of 10/10.